next, we have Dr. Caitlin Rublee, who's an assistant professor, an emergency medicine physician with the Medical College of Wisconsin, and she was also one of the attendees at the Glasgow meeting. Her focus is going to be on the overall medical response to climate change. And it's a pleasure to have you with us, Caitlin. So we'll turn the voice over to you.
All right. Do you see my slides?
I can see them and hear you.
All right. Well, thank you so much, everyone, for a wonderful conference, and for Dr. Benjamin for really setting the stage of what emergency care and the partnership between medicine and climate change can look like. I want to take it a next step and really talk about emergency care systems and look at pre-hospital care, transport, and then facilities care. And think about what we do as really more than a resuscitation and what we can do as stakeholders, each and every single one of us, to prepare now for climate change and what is to come. So I will briefly review some of the climate change impacts, especially as they pertain to health. We've heard a lot about this today. I will go briefly through it. And then I really want to get you to think about health system disruptions in the setting of extreme weather events amplified by climate change, and identify some solutions to strengthen health systems as we move forward that will support health right now and for years to come. And then lastly, get you to recognize the value in preparedness, not only at the community level, but also at the individual level for you yourself as a researcher or as a clinician, and at the health system level. So hopefully you have this memorized by now. There will be no quizzes or tests on it, but really the focus will be the upper left-hand corner and talking about, again, heat-related illnesses and deaths, how heat directly causes harm and multi-organ failure and even death, but it makes many other conditions worse as well. And then how extreme weather events amplified by climate change really cause insult in the short and long term that we see in the emergency department. As an emergency medicine physician, my view of climate change is really informed by providing care to many of these patients, by treating their conditions, their infections, their asthma exacerbations, and it really informs the policies and whatnot as we move forward. So I will share some of that with you today. Now, what we hear about impacts of heat are usually the direct impacts related to heat-related illness. One of the things I think about is what the treatments look like. About a year ago, I published a paper with colleagues on the evidence of treatment of heat stroke in the emergency department setting. And it's very resource intense, as many of you are aware. It includes a whole team of health professionals, respiratory therapists and pharmacists and nurses and physicians, EKG technicians coming together to treat one patient and cool them as quickly as they can, cooling an entire human body within 30 minutes, ideally. What happens in the wake of heat waves like what we saw in the Pacific Northwest? My colleagues, were treating many people, and what happens is the burden shifts. Other patients there for acute emergencies don't always get as prompt care as they get as they require, and then care is impacted and quality of care is impacted. As we have heard previously, heat also makes many other conditions worse. There was a recent article in the British Medical Journal by Dr. Sun and colleagues just talking about how during these warm days, emergency department visits increased for all causes, for heat-related illnesses, for mental health, and for renal diseases. In the setting of climate change, that burden is only going to grow. Certainly, hospitalizations are an issue as well. We do not have unlimited resources. And right now, if you have walked into any emergency department, and many of you are probably too familiar with this, many of our hospitals are full. And so any chance we can get to reduce that burden impacts people. The indirect impacts of heat are less obvious to many people. I think about health services, particularly emergency medical services and our first responders. Ambulances are overburdened in the setting of any of these heat waves frequently as well. They are in charge of not only responding to new calls and new pickups, but also they're relied upon for transportation from emergency departments for discharged patients back to the nursing facility, for example. There are long delays with some of these calls. There's constant prioritization, and there's also an occupational harm to many of the workers. Certainly trauma, accidents, and lost productivity. When I see a patient come in after they fell off a ladder and they have polytrauma, perhaps an open femur fracture and a head bleed, we don't always do a great job asking what caused them to fall off the ladder. And more you'll see their palms got sweaty, they got heat exhaustion, and what have you. There's also lost productivity when it comes to work. Outdoor workers are an excellent example, and it takes more time to do the same task. And then certainly thinking at a community level about infrastructure disruptions, I would also like to encourage you to think about it at the health system level. Our hospitals need power and oxygen and water to operate at the level that our patients expect in many of our communities. And so in the setting of increased energy burdens, increased heat, what does that look like? This is a reminder that this just isn't about the patients, but it's also about us as clinicians, because we will be increasingly asked to respond to these events, and we have to go to work. So I want you to take a minute and think about everything that goes into you getting to your job. Perhaps it's been virtual, but thinking back, perhaps you need an alarm, and energy, food and water, some sort of transportation, childcare. And then at work, you need many different resources. This is just one example of an IV starter kit and labs. Then you need a whole lab technician and a lab to run the labs and get results in order to provide care. And so there are many facets that can be disrupted. It really encourages us to think about a reactive versus a proactive approach as well. So if you are not familiar, I encourage you all to look at the World Health Organization Climate Resilient and Environmentally Sustainable Healthcare Facilities report. So essentially what it does is provide a framework on how we can be proactive. Most of our waiting rooms do not look like that. They are filled, every chair is filled and people are waiting. And so when it comes to any of these extreme weather events, it can be the final straw that tips things over. And then patients who come in with other emergencies, for example, obstetric emergencies, are forced to wait. What would it look like if instead we had a trained climate-ready health workforce who are familiar with local climate threats? If we had energy resilience and renewable energy that incentivized health and wellness, an infrastructure that was strong, even in the setting of some of these floods and fires. Again, there are many examples of places that have already done this, and it's very doable if we commit to it. We, all of you as listeners, and we as clinicians and researchers, need to be active participants. And so at the individual level, it's thinking about your own personal evacuation plan and housing arrangements. What happens if your house got evacuated and you still had to come to work as an ER doc, for example? It might be childcare arrangements if that falls through, medications, having backup generator energy source yourself. From a health system standpoint, we need actionable disaster plans that incorporate a climate lens and incorporate vulnerable groups, right? So we need diverse stakeholders, just like we have at this conference today at the table. We need a climate-ready workforce. Vancouver Coastal Health is an excellent example of this, where they're doing trainings in their hospitals for their workforce on climate change. Certainly decarbonization, when 8.5% of greenhouse gas emissions in the US is from the health sector. In providing care, we're actually doing harm. And how can we change that and set an example and a new standard within our communities? Building climate resilience across emergency care systems, for example, from the scene, the transport, at the facility, What does that look like? And then certainly expanding transdisciplinary partnerships and rethinking the way academia and health systems can engage with federal agencies, with organizations, and within the community to incentivize health and wellness. At the community level, we've heard a lot about this, certainly adaptation plans, such as early warning systems, that incorporate health. And that means we in the health field getting involved in some of these circles. Certainly targeting vulnerable groups, physicians, health professionals, researchers know some of these vulnerable groups more than anyone. Who are those individuals in your community that need to have a seat at the table? Certainly engaging in the policy process throughout the entire spectrum has profound implications to scale change. And it can be a policy at your health system or institutional level. And then finally, designated leadership with a health focus. A great example of that is Miami, who designated a chief heat officer. I love this picture. It's the jaws of life, right? So it's used frequently to get people out of a car after a wreck as fast as we can. It's part of a system of you call 911, people respond. We get you to care, definitive care, as fast as we can, because we know that time matters. Time to intervention matters. And any delay in the pre-hospital setting could mean the difference between life and death. In the same way, we need to think about climate change and our work that we're doing here today and in coming months to years as being that time sensitive. We need to prioritize what matters, and that's health, right? So why do we work so fast? As a physician, it's to give people more quality time, more babies, weddings, birthdays, all the things that matter to our communities. And it's not just for some, but it's for everyone, with that underlying goal, as we've heard time and time again, to reduce disparities and address the inequities within our communities and across our nation. So what does success look like? Certainly, there are many different visions, but here's what I have to say, and many others have influenced this. So certainly an educated workforce, collaborating across disciplines, as we've talked about, for collective action, setting priorities and keeping them, prioritizing equity, influencing policies, physicians as policy influencers, operationalizing plans, right? Don't just write the plan, operationalize it, and then measure interventions, which is so important to continuing success. Every system is perfectly designed to get the results it gets. We cannot just roll the dice and guess. This is about human lives. Climate change is a public health issue, first and foremost, and people's lives are in our hands. Fortunately, there are many wins already. If you have not heard, there's been more than 230 medical journals that have declared climate change as a major global health threat. The Lancet Countdown on Health and Climate Change comes out with an annual report and policy brief. The Healthy Climate Prescription was endorsed by 46 million health workers from around the world. The National Academy of Medicine has the Action Collaborative on Decarbonizing the U.S. Health Sector. There's a U.S. Sustainable and Climate Resilient Healthcare Facilities Toolkit that can help us operationalize some of these changes across this country. And then from an educational standpoint, there's a Global Consortium on Climate and Health Education. I encourage you to go there for any sort of resources. You all know enough. You can brush up on a few areas of interest. There's tons of resources. And then there's Medical Students for a Sustainable Future, stepping up and leading in their communities. There's physician fellowships in climate medicine at the University of Colorado. I was fortunate to spend a year studying climate change and health policy and really incorporating and integrating disaster preparedness and my interest in medicine at the intersection. Certainly a climate and health equity fellowship and climate health organizing fellows program. This is only just the beginning. The Medical Society Consortium on Climate and Health has many more resources for you. So let's prepare now. Let's focus on opportunities, effective messaging, share evidence, and most importantly, those stories that make it real within our communities. Collaborate across disciplines, dare to think global. Remember, we're just part of a broader spectrum. And if we have learned nothing in the past 2 years, it's how connected our continents really are. And then really thinking about leading in climate smart healthcare, low carbon and climate resilient health systems. So I was at COP just a couple of weeks ago, and Assistant Secretary Dr. Rachel Levine, again, launched and articulated the US commitment to many of these issues. And so times are changing. We are here, we are ready. And it's up to us now to really move forward and think about providing climate action in a time-sensitive manner for our patients. Thank you.